Hi everybody, fantastic to welcome you all here today to our Advocacy Talks session for May. Today's session is the potential of the public sector equality and human rights duty for advocates. We're delighted to have you all with us today, and we're absolutely thrilled to be joined by Jacqueline Healy from the Public Sector Equality and Human Rights Duty section of the Human Rights and Equality Commission. The Irish Human Rights and Equality Commission is Ireland's national human rights and equality institution. It is an independent body that accounts to the Oireachtas and has a mandate that was established under the Irish Human Rights and Equality Commission Act in 2014, or the IHREC Act for short. IHREC's purpose is to protect and promote human rights and equality in Ireland, and to build a culture of respect for human rights, equality and intercultural understanding in the state. But before I hand over to Jacqueline today, I just want to remind you all that we have some time for questions at the end of the presentation. So please do be sure to put any questions you may have into the chat or the Q&A section, and Liz will go through them with Jacqueline at the end of our session today. So without any further ado, I'm going to hand you over to Jacqueline Healy.
Thanks very much, and thank you. Good afternoon, everyone, and I'm very happy to be here today to talk about the public sector equality and human rights duty. So I have some PowerPoint slides because I think it's a bit of a complicated area sometimes to go through. So I thought I'd do some slides. But before I do that, I might just get colleagues here to share an animation, a 3-minute animation on the public sector duty, so it describing what it is and what public bodies are required to do. So if we could just go to the animation, please, that would be great. Thanks.
Hi everyone, there's just no sound on the video. Sorry about that. We're just fixing it now, and we'll try it again.
People in Ireland rely on services provided by public bodies on behalf of the state every day. From colleges and hospitals to libraries and the courts, these services are essential, and it is important that they can be used by everyone. The public sector equality and human rights duty is a legal obligation on you as a public body to eliminate discrimination, promote equality of opportunity, and protect the human rights of your staff and the people who use your services when carrying out your daily work. It's a positive obligation that requires you to be proactive, to think about human rights and equality issues in your work and address them before they become a problem. The duty applies to the whole organisation, including corporate services, procurement, human resources, service provision, research, policy and regulatory functions. To meet the core requirements of the duty, you must assess, address and report. First, assess. You must carry out an assessment of the human rights and equality issues relevant to your work. This assessment must form a part of your strategic or corporate plan, which should be accessible to the public. The assessment should be based on evidence. Input from staff and people who use your services is key, as is using internal and external sources of information and data. Remember that equality does not always mean treating everyone the same. It is about considering the particular needs of people so that similar outcomes can be achieved. Certain people or groups of people may be more at risk than others of experiencing discrimination or human rights violations, and careful consideration must be given to include these concerns. Secondly, address. You must set out in your strategic or corporate plan the policies, plans and actions to address any issues raised in the assessment. You can include actions you may have set out under different national strategies or policies, or under the public sector reform programme that are related to equality and human rights. You will need to think about positive actions you can take to meet the needs of people at risk and consider reasonable accommodation for people with disabilities. Finally, report. You must report annually on progress and achievements in a manner accessible to the public, such as your annual report. Integrating the duty into your strategic plan and annual report means that it is an ongoing obligation that must be monitored, reviewed and developed in each strategic planning cycle. The duty has the potential to positively transform how public bodies engage with members of the public and their own staff, to make Ireland's public services more inclusive and more effective, and to achieve an Irish society where everyone and their rights are treated with respect. The Irish Human Rights and Equality Commission has produced a guidance for public bodies on implementing the duty. You can access this guidance and learn more at ihrec.ie.
Thank you, Lorna, and everyone for sharing that. I know we had a bit of a sound problem, but that is normal. So I was just going to open just to share the presentation. So just give me one moment, please. And I hope I'm just going to put it onto to the slideshow so that people can see it clearly, hopefully. So just let me know that, Lorna, can everybody see that?
Yeah, that's perfect.
Great.
Thanks so much.
Thanks very much. So we just played the animation there, and what I wanted to do was just go through some of it in a bit more detail with you today. So the public sector equality and human rights duty is contained in section 42 of the Irish Human Rights and Equality Commission Act, like our founding legislation essentially. And really it has existed in other jurisdictions, just like the UK and Northern Ireland, and it was in 2014 that it became part of Irish law. And what I'm going to go through is what it actually says in section 42. So what it says is that a public body shall, in the performance of its functions, have regard to the need to eliminate discrimination, promote equality of opportunity and treatment of its staff and the persons to whom it provides services, and to protect the human rights of its members, staff and the persons to whom it provides services. So again, this is for public bodies. It's been around for about 7 years in Irish law, since 2014, and it applies across all the functions of a public body, and I'll talk about that in a minute. And really it's about a public body being positive and proactive around equality and human rights. So instead of waiting for a complaint to be made or an issue to arise, what it does is it looks at, okay, what are the issues for us across a range of equality grounds and human rights, and what should we be doing to be proactive? So as I said earlier, it applies to staff and to service users, so that's important to remember as well. So that they are essentially the key parts of it. And also Section 42 actually sets out what a public body has to do. So that's in Section 42(2), and it requires a public body to set out in its strategic plan an assessment of the human rights and equality issues it believes to be relevant to its functions and purpose, but it has to do it in a manner accessible to the public. So we need to know that this assessment has taken place. The second thing is to set out in its strategic plan the policies, plans and actions in place, or they propose to be put in place, to address the issues that have been raised. But also they need to do it in a public way. So again, we need to be able to see this action plan. And then the third step is to report. Annually, they have to report on progress and achievements in relation to those actions, again in a manner accessible to the public, such as an annual report. So you'll have seen in the animation there, assess, address and report are three ways of remembering the public sector duty for advocates. So you might say, like, what is a public body? You know, I mean, there's a lot of public bodies out there, and the definition of a public body in our founding legislation is actually quite broad. So it includes departments, local authorities, HSE, universities, institutes of technology, ETBs, the education and training boards, but also any other organisations established under statute or under schemes administered by the government. So it's quite a broad definition of a public body. So there's a lot of public bodies that you can communicate your issues to. And then another common question that people might ask is, like, what are the key human rights and equality obligations on public bodies? So when you're talking about the public sector duty, what is the rights and the equality issues that have to be considered? And obviously, first port of call is the equality legislation, so the Employment Equality Acts and the Equal Status Acts. But also human rights is also a part of it as well, the human rights that are protected under our Constitution, the European Convention on Human Rights, and then any other international treaties that have been given the force of law in Ireland. So there's some of the equality and human rights issues for public bodies to consider. And I guess a question many people might ask is, well, why is important, and why was this duty introduced into law in the first place? Well, it's the state's responsibility to respect, protect and fulfil human rights in line with its international obligations, and to be proactive in ensuring that all public bodies are human rights and equality compliant. So again, as I said before, instead of waiting around for the issue to raise its head, public bodies should be in line with their international responsibilities, making sure that their house is in order with regard to equality and human rights, because it can improve public services and it can improve workplaces. And that's the whole essence and idea of the public sector duty. So as I mentioned earlier from Section 42, the strategic planning cycle is very important for the duty in public bodies. So when a public body is preparing their strategic plan, that is the time that they need to be doing their assessment and doing their public sector duty. And the reason for this is because then it becomes part of their daily business. So if the duty issues and actions are in the strategic plan, it's more likely to fall into the annual work plans and become part of daily business of a public body. So if you as an advocate are going, well, I'd love to communicate my issue to a particular public body and it's an equality and human rights issue, it is always good to check when their strategic planning cycle is coming around, because that's an opportune time to do it. Now, last year, the government departments did their strategic planning cycle. So, and many of them had either the duty referenced in their strategic plan, or they had an assessment and action plan laid out in it. So you might just see some examples there of what the public sector duty looks like in practice in some of those. I also mentioned earlier on about the duty applying across the functions of an organisation. And this is really important because it doesn't get like siloed into a social inclusion unit within a public body or corporate services, but it applies across the organisation, so you can have a whole of organisation approach to equality and human rights. And some of the functional areas that apply are corporate services, so like things like strategic planning, budgets, procurement, grant funding, for example, but also a public body's human resources, so how they do recruitment, their HR policies and practices, and staff capacity building. When a public body is doing their duty, they also need to look at, of course, service provision, how they deliver a service to a diversity of service users, and how they engage and consult with key stakeholders. Also, a part of a public body's function might be research and policy, and that's also has to be assessed as well. And then if they're a regulatory and oversight body, they need to look at that particular function as well. So say, for example, IHREC, who is a regulatory body for health and social care services, they would need to look at the duty and see how their regulatory functions need to be adapted to take account of equality and human rights. IHREC produced guidance on the public sector duty for public bodies, and there's actually quite a bit in the guidance. Like, if you are an advocate and you want to use the duty in your advocacy work, it's really well worth reading the guidance, because it really gives you a sense of, well, where could I, use the duty in my work, and it would support you to do that. But obviously the guidance we produce is mainly geared at public bodies. And I just have a slide here, which all it does is just gives the front cover of the guidances that we have produced. But I'll share the slides with anybody afterwards, and I have the links to all the guidance that we've produced so far. So we've produced a guidance on consultation, how public bodies can consult with rights holders and civil society organisations, but also how to do an assessment. And we also have a lot of information on our website as well. And one of the key things we say to public bodies, look, one of the key messages of our guidance is that they need to adopt an evidence-based approach to their assessment. And one of the key ways they can do that is consultation with staff and service users. And I think that's where rights holders and civil society organisations can really play a part in making sure that the duty is implemented in a meaningful way. But also, like, the reports that civil society organisations and submissions that they produce are also a very rich source of information for public bodies, for them to know, like, well, what are the equality and human rights issues for our organisation? Because, like, in fairness, any public body could sit down and do a quick assessment and go, oh, actually, I don't see any equality and human rights issues here. But when they go out and consult with staff and service users and look at a number of reports, they will find that there actually are quite a few issues that need to be addressed. So I wanted to say that's one of our key messages from our guidance. And that leads me on to talking about, you know, consultation and the role of civil society in supporting the implementation, mainly the meaningful implementation of the public sector duty. So again, we came out with a guidance on how to do a consultation in 2020, and the key messages to public bodies in that document, in that publication, was consult with service users and staff at each of the 3 stages of assess, address and report, and do it in a timely way and as part of your strategic planning cycle. Also, make sure it's an inclusive consultation with all identified groups. So look across the 9 grounds and look at people at risk of poverty and social exclusion. And invite groups to give feedback on the draft assessment, the draft action plan and the draft report on progress and achievements, and really take an evidence-based approach to implementing the public sector duty. So I feel here that there's a great potential for rights holders and for civil society organisations to raise their issues when they have like issues with particular public bodies. I think that the duty is a very good tool to do this. So there again, just to say, like, from civil society organisations, IHREC would encourage civil society organisations to use the duty in their engagement with public bodies, in their advocacy work, in their policy work and in their campaigns work with public bodies. And if they wanted to reference the duty, that would be great. It is a great opportunity to communicate rights holders' expertise to support public bodies to adopt an evidence-based approach to their equality and human rights assessment and action plan. And we feel that civil society and rights holders are our partners in monitoring compliance with the duty, but also when we go to enforce the duty as well. We did a number of pilot projects a few years ago. Well, actually, it was only a number of years ago with public bodies and one with civil society. And the one we did with civil society was with an organisation called Community Action Network. And they're a social justice NGO that facilitated drug service users to identify the human rights issues that affect them when accessing drug treatment services from the HSE. And this pilot the idea of this pilot was to encourage rights holders to present their issues to the relevant public bodies. So it really was a grassroots approach to implementing Section 42. And the project, they held dialogue events, they conducted service user research, they interviewed service users, and they compiled a report on the issues identified. And then they met with the Department of Health and the HSE and presented these issues. And they made it into a report as well. But there was a number of key kind of policy wins from that work. So, for example, it was a practice that there was supervised urine sampling that was happening at the time that people felt was really violating their right to privacy and dignity when accessing the services. And after the project, that practice is now virtually eliminated. So that's to give you an example of, you know, how you can use the public sector duty to advance a policy aim or objective that your organisation has. And at the end of my presentation, I'm just going to ask Lorna to show the video. I might just finish my slide deck here, but then I'll ask Lorna to share the video of the pilot so that you can get a good idea of how you can use the duty as an advocate. Okay, study there. But I also just wanted to say to you that I wanted to think, I was thinking this morning about like, what are the key questions for advocates when they think about the public sector duty? Like if you're saying, like, I'd like to use the duty in my advocacy work, the first question you can ask yourself is, has the public body published an equality and human rights assessment or action plan? And if they haven't, that's a key moment to communicate your issues, especially if the public body is doing its strategic planning process. Now, I have to say that there is low compliance with the duty at the moment, so there's quite a likelihood that a public body hasn't done their public sector duty. So really the time is very good at the moment for that. And what are and as an advocate, you can also ask, what are the key human rights and equality issues for children and adults who are visually impaired in relation to this public body? So what what are the key issues for yourselves? And then what are the actions needed to address these issues by this particular public body? And then I suppose another question is, how can we effectively communicate these issues to the public body so they take them into account when they're undertaking their assessment as part of an evidence-based approach? So I just thought I'd say, like, these are some of the key questions for advocates when they're using the public sector duty. And I'm just going to end with the Commission's role in relation to the duty, just to give you an idea of what our role is in IHREC. Our role is guidance, support, monitoring and enforcement. So I already mentioned the guidance earlier on. We produce quite a number of guidance, and also we can prepare guidelines and codes of practice, and actually we're in the middle of the start of preparing a code of practice on the public sector duty. And then a question that gets asked to me a lot is, if a public body doesn't do their public sector duty, what happens? And very good question. And IHREC does have a power in section 42.5 where it can ask that public body to do their public sector duty, to carry out a review and an action plan. So that's we haven't used that power as yet. And also, IHREC has a role around capacity building on equality and human rights, not just in public bodies, but we are focusing on public bodies at the moment because of the public sector duty. And we have worked with the IPA for the professional diploma in human rights and equality. But we've also recently developed an e-learning module for public bodies on equality, human rights and the public sector duty as well, in order to assist them in the public sector duty obligations. So in the slide deck that I have put in a list of resources for people to get more information on the public sector duty. But what I would do now is I would just probably unshare what I have here, if I can, and maybe if Lorna could play the video. I stop presenting. Brilliant.
Just bear with me for a moment while I pull that up.
Thanks, Lorna.
Hopefully this time we'll hear it from the very start.
Fingers crossed.
Can you let me know if you can hear that?
All good, love.
Community Action Network, CAN, is one of 6 organisations that worked with the Irish Human Rights and Equality Commission on a pilot basis to support implementation of the public sector equality and human rights duty. The duty is a statutory obligation on public bodies set out in Section 42 of the Irish Human Rights and Equality Commission Act 2014. It requires public bodies, when carrying out their daily work, to have regard for the need to eliminate discrimination, promote equality of opportunity and protect human rights of staff and service users. Cecilia Forrestal is Human Rights Coordinator for CAN. CAN is a social justice NGO which places people at the heart of change.
In the context of this project, the people are the men and women who have been living for a long time on methadone, and the change is in the way in which their services are delivered and in the way in which their right to adequate health is progressed over long periods of time.
This pilot is different from the others because it is led by service users through the Service Users' Rights in Action group.
We're very much trying to work with people who are vulnerable, excluded, powerless to get to decision makers. It was based on their evidence, their experience. So in terms of, thinking public sector duty, it is about that kind of assessment, but it was their assessment of what the issues were. And it sought then to bring about engagement with the whole system.
Niall O'Connell is a member of the Service Users' Rights in Action group.
I think when you're affected personally by the issues, it makes it all the more, obviously you're going to be motivated and enthusiastic, and you're able to tease out the very personal impact that these issues were having, like people, basic clinical issues that, were being addressed.
In 2016, the Service Users' Rights in Action group received a letter of support from President Michael D. Higgins. This facilitated them to extend an invitation to key stakeholders within the drugs services and elsewhere to attend a dialogue.
We held a very structured conversation whereby the service users laid out their own experience in a very powerful way, and then we asked people who were service providers to lay out their experience, and then policymakers to lay out their experience.
Emily Reaper and Paula Carney are both members of the Service Users' Rights in Action group.
To try and bring about change was so slow, so annoyingly slow. And here we had these figureheads now, with doctors supporting us, with the human rights, with the Ombudsman, and we had Michael D.
So to actually see that people did come to the dialogues and things like that and get involved and actually listen to what we have to say, that's very important.
A number of key values were identified as critical when reflecting on service users' experience of engaging with drug treatment services. These included dignity, participation, non-discrimination and autonomy.
One of the things that stuck out for me was the word dignity, because that seems so important in terms of being treated in a dignified manner, and I always believe that if people are treated with dignity, they respond with dignity.
Dr. Garrett McGovern is a GP specialising in substance abuse. He is one of the steering committee members that originally came together with the Service Users' Rights in Action group to address concerns relating to the human rights of people who are on long-term methadone treatment.
We began to realise actually that the centre of this is going to be the service user. The service user now is not going to accept this anymore. And this is exactly what's going to change it.
The core steps to implement the duty are based on statutory obligations: assess, address, report. The Service Users' Rights in Action group documented their key issues and recommendations in a report that was informed by peer-led research.
And we identified that there were a number of issues that we reckoned were violations of human rights, and particularly had to do with the lack of respect, dignity, privacy, the lack of meaningful participation and choice, and the lack of a proper system of making complaints and people feeling empowered that they were active agents in the delivery of their own health.
We identified the issues through research, and the biggest one was observational urines, because you get observed in a toilet and urinate while someone's looking at you and there are mirrors surrounding you. So you can see up, across, down. They were great issues to work on and I agreed with them, but the engagement with the doctor is really probably the most important and the hardest one to achieve.
The culmination of it was the pilot project was a report called Our Life, Our Voice, Our Say. And our life is the documenting the lived experience, our voice is service users articulating that, and our say are the 28 recommendations that they have come up with about how this could be achieved.
Leadership and organisational commitment are key to implementing the duty. The lived experience of people accessing an organisation's services is key to informing an evidence-based approach to assessing and addressing equality and human rights issues.
One of the achievements of the project has been that a letter was sent to all clinicians by the clinical lead of the service saying exactly that it's not necessary, and it's not necessary with the frequency that it's being conducted with.
And we've got to get to a stage where the people that can make these changes at policy level in the HSE actually do so. I think we're beginning to see the start of that. I'm going into clinics now with big posters, not on walls, on the doctor's door, about supervised urine is gone.
During the pilot, members of the steering committee met with Dr. Philip Crowley, who works nationally for the HSE on quality improvement and quality and patient safety. He also works as a GP and has been involved in the delivery of drug services.
Kind of a national leader in the HSE, I try to facilitate an interaction between the process of engaging service users and those who are actually managing and running drug services. You know, the people who use services for a prolonged period of time are the ideal people to be involved in designing them because they know them so well. New policy that was designed to de-emphasise urine sampling was a direct result of the interactions with CAN and with the service users. You know, it's been good for us to even engage in an exercise in public sector duty to kind of wrap our heads around how many other sectors and areas of our own operations we need to really consider in relation to the public sector duty.
The Service Users' Rights in Action Group reflected on how to take the work of the pilot forward.
We really believe that this service is made up of men and women, whether they be service users or service providers, who ultimately want to deliver a high quality service. So public sector duty framework allows us to sort of extend that message, because public sector duty is all about not only the service users but the staff and everybody else involved in the service, providing services of dignity, respect and inclusion and all of that.
For the future, I'd hope that the group will stay together. We have a lot of energy, but there is an energy there because we've achieved a little bit. But achieving a little bit in our world is a lot to achieve. We're passionate about these things, really are. So hopefully we'll keep going.
More information can be found at ihrec.ie.
Thanks, Lorna, for that. Actually, just to say at the end of that, that group is still going strong, actually, and advocating and using the public sector duty and still engaging with the HSE and the Department of Health. So that's just an update on it. I say thank you very much for listening, and I'm very happy to answer any questions.
Thank you, Jacqueline. It's Liz Jeffrey here. That was wonderful and so much to consider, and what a great resource and tool, as you said, you called it, for people to use when accessing their rights. A couple of questions for you. As you're aware, NCBI have several local advocacy networks all around the country, and the members of our advocacy networks are learning those skills about approaching public bodies. About their rights in all sorts of areas. One of the questions here is, when they go to an organisation, is there someone in particular that's responsible that they would, if they weren't getting what the feedback or the the response that they wanted? Should there be somebody in the organisation that's responsible for monitoring the whole of organisation public sector duty?
Yeah, so like, as I was saying earlier on, some public bodies have started their public sector duty. So, you know, they might have set up a working group, or they might already have an equality committee or an EDI group. It's sometimes called Equality, Diversity and Inclusion Group. So say, for example, in the HSC, there's an EDI unit that was set up, and they were doing the public sector duty. But say in a big department, it could be the responsibility of the corporate services division to lead it, and then they're bringing in different people from across the organisation. So it's a very good question, because sometimes it can be hard to identify, like, well, who do I contact about this? But I have been approached by other organisations who've said to me, like, this local authorities, I know they're doing the public sector duty at the moment. You know, how can I engage? And I usually just say to them, go to the very top of the organisation. You know, so go to the chief executive or the CEO of that organisation and say that I'm aware that you're doing your public sector duty, or have you done, if you're not sure, have you done your public sector duty, and just say I would like to engage, because that's probably, because whatever happens, it'll be delegated from that office down to the appropriate person within the organisation then, because it can be very difficult at the moment to figure out who's doing, and it varies from sector to sector. So I'm sorry, I'm not able to give a particular answer to that, but obviously if people are interested, they can always contact myself in IHREC, and I may know the contact person in that place, in that public body.
I think that's a great answer, Jacqueline. Go to the top, because the top.
It usually works, actually. Yeah.
And following on from that, another question we have is here: should it get beyond, you know, even not getting advice about all of that, all of who's responsible, and people want to make a complaint? How do we report public sector bodies to IHREC if they refuse to comply with the duty?
Yeah, well, yes. Now you can definitely get in touch with me about that. So the public sector duty team is here in our, now we're a very small team, but like if you feel that a public body like it hasn't done their duty or isn't doing their duty, like come and talk to me about it. And again, I actually engage with a lot of public bodies, you know, so there I may be like be able to put you in touch with the person who is dealing with it within that organisation. But at the moment, like we do have, as I said, an enforcement power, but we haven't used it as yet because, well, first of all, we're doing a lot of guidance and support with public bodies, which is actually been quite effective because there are quite a lot of public bodies who are at the moment starting the journey as such, if you know what I mean. So that's really been our focus up to now. But we're going into a new strategic planning period, and what we've identified is we're going to monitor compliance with the duty and publish compliance statistics, and then based on that we will move to enforcement. It's not something that we feel like we want to just go around with a stick. It's not from that point of view. We'll still provide guidance and support to public bodies, but we do still want to make sure that it is an effective, you know, an effective tool for advancing equality and human rights in public bodies.
Thank you, Jacqueline. So how do people know when they approach a public body and what they're asking for?
Yeah, so
how do they know whether it falls into the public sector duty realm, or whether if they're told, oh, you can't have access to that information, or you don't have a right? How do they know that it is a public sector duty issue?
Well, you should. Yeah, very good question. Is like that's what I was saying in one of the slides, that every single the assess, address and report, all of that has to be done in a manner accessible to the public. So I should be able to go on to any website of any public body and be able to see, well, have they published their assessment in their strategic plan? Have they published their action plan in their strategic plan? Are they reporting on the duty in their annual report? And you can see very quickly when it's not happening, when you don't see anything. And then the very strong likelihood is that they haven't started the public sector duty, you know. So to give you an example, say the Department of Transport, last year, they if you go onto their strategic plan and if you look at their annual reports, they are reporting on the duty, and they did do their assessment and action plan, and they published it separate to their strategic plan because their strategic plan is a very short one, so they published it separately alongside the strategic plan, which is absolutely fine as well. People do it differently, but so you can see then that the Department of Transport have implemented their duty or are implementing their duty. But then if you go to other public bodies, you may see no evidence of anything. So if you can't see it in a publicly accessible way, Liz, then they haven't done their public sector duty. So it's quite easy to figure out who's in compliance and who's not.
Okay, and is there a period, given that this has come in just 7-8 years ago for 2014, is there a period by which you'll be allowing people to catch up, giving them guidance when you will start enforcing this for those that aren't bothering even to start?
Well, we always say to public bodies, because people ask, so when do I start my duty? And I said the 1st of November 2014. Was the day it came into law, and from that point on, public bodies were required to do their public sector duty. Obviously, they needed time, and we needed to publish our guidance, but we published our guidance in 2019, so in March 2019, and that was the core guidance of the duty. So really that was sent out to all public bodies, the heads of all public bodies and the heads of corporate services and public bodies. So really public bodies really knew at that stage you have to implement this statutory obligation, and here's the guidance. So really at this stage this year we're going to be the monitoring compliance, and then it's at that stage, once we have the evidence of who's in compliance and who isn't, we will look then to see, well, what should we do with this information? That's not for me to decide now, Liz, that's the commission members in IHREC. But we are moving in that we want to make sure that the duty is being complied with by public bodies. It's very important.
And on that subject, Jacqueline, who do they report to, apart from in their public bodies and their strategic plans? And how will you know? How will you monitor? How will you monitor and evaluate those that are and those that aren't?
Yeah, so the duty in Ireland is a bit different from the UK. In the UK, public bodies actually report to, sorry about the sirens in the background here if you can hear it, I'm just in the office. But the public bodies in the UK report to the IHREC equivalent in the UK. But here in Ireland, the duty is a self process. So they do their own assessment, their own action plan, and they also do the reporting in their annual report. How we monitor is really what I just said there. Like if I'm going out to do a presentation to a public body, before I go out my preparation, I will look at their strategic plan. I will look at their annual reports. I will see where the duty is, and has it been mentioned? Have they done their assessment? Have they done their action plan? If I can't see any evidence of that, then they're not in compliance with Section 42.
Are there any plans in the future, Jacqueline, to have public bodies actually lodge those reports, maybe with yourselves or somewhere else, so they have to actually lodge a report every year?
No, there's no plans at the moment for that. No, it's at the moment it's unless there's changes to the legislation. But at the moment, that's the process that they do the process themselves. But obviously, IHREC has a monitoring and enforce. We're sort of the guardians of the duty, so we monitor and we enforce. And obviously, we do a lot of work with civil society, like this event today. Just kind of saying like we we can't be all over the public service. We're only a very, very small team. So we do rely on, you know, other, like say civil society and other bodies to tell us, like, you know, they haven't done their public sector duty or whatever. And like when somebody hasn't done their public sector duty, like I'll reach out and say, would you like me to come in and you know, do a session with maybe your senior management team. So, you know, we try to be as proactive as possible within the constraints of our team.
Yes, and I'm sure there's plenty to get around for you, Jacqueline. Just one final question.
Plenty of requests anyway, Liz, yeah, for sure.
One final question relating back to our local members of our local advocacy networks who are working very hard in different areas in all their communities, identifying, addressing local issues. You've mentioned the strategy of going straight to the CEO, but is there a way of presenting the public sector duty at that initial contact with public bodies that you've seen works best for them, might work best?
So is your question, Liz, like if you want to, if an advocate wants to go and present the issues, maybe go in and have a meeting, is that correct?
Yeah, so it could be, there could be a group sort of, well, there's all sorts of issues, but let's call it something like, you know, not putting in traffic light crossings at particular areas where people can cross, their independence is affected. Yeah. They feel like they don't have equal access to the communities, and they're going to write a letter to the council. Is that what they should put reference to the public sector duty in their letter?
Yeah, absolutely. Like that's what I've assisted, you know, like, I mean, I haven't written the letters, but when I've just given advice to people, like what I normally say is, like, you know, there might be a few issues that you have, like, say to a particular, say it's to a local authority and you have a few issues like that. Like I feel it's very strong to say, you know, this is the public sector duty. It would be good to check their strategic plan first, because a lot of them have a commitment. We are committed to the public sector duty, and you could say in the letter, we note that in your recent strategic plan, you are committed to the public sector duty, which is to have regard to the need to eliminate discrimination, promote equality of opportunity, and protect the human rights. And in that context, we are writing to you to highlight the following issues. And I feel it strengthens those arguments, because you're linking your issues to a statutory obligation. And there might be a bit, you know, when it's received by the local authority, it might be like they might be doing something on the duty, or they mightn't. But like, if they are doing something on the duty, those issues can feed into the assessment. And if they're not, it might kickstart the work on the assessment. They might call ourselves an IHREC, and I'd be very happy to help them get started on the duty, you know. So I think that's a great question, is like that framing of the issues with the public sector duty. But I would advise people to first of all look to see what's in their strategic plan, because if they have something in there, it's even stronger to link the two.
Absolutely, do your research first, and I think that's very, very wise advice, to be knowledgeable of where organisations are at, or who's responsible for the area that you're trying to address. Well, we'll certainly take all this back to our local advocacy networks. Thank you very much, Jacqueline. I'm going to pass back to Lorna.
Thanks so much, Liz, and thanks, Jacqueline. I honestly, every day is a school day as far as I'm concerned, and I know I definitely learned a lot during that presentation and discussion, so thanks so much. I think it was very insightful, and I think there's a lot for us to take away from that. Really interested in what you're saying there around you know, the production of reports, or producing reports around compliance, and I think it is back to that age-old saying about what gets measured gets done kind of thing, and being able to publish such reports will be really, really useful in progressing the work that's already underway, as you say, in many areas, but it really was fantastic. So thank you so much for your time today, and for your presentation.
Thank you, Lorna, with all the technical issues. Thanks a million.
No problem, no problem. There's always a technical challenge, but we get over the bumps in the road. But just a reminder before we close off today, that these advocacy talks are a monthly initiative brought to you from the advocacy team. They take place on the third Thursday of every month, and you can look back at previous advocacy talks sessions on our YouTube channel. You can also find out more information about all of our upcoming advocacy events, such as our Introduction to Campaigning training, which is taking place next week, alongside all of our local advocacy networks that Liz mentioned during the Q&A. You can find all of that information on the NCBI website. Just head over to www.ncbi.ie and search for upcoming events, or drop us an email on campaigns@ncbi.ie and one of our team will come back to you. But just again to say thanks so much to Jacqueline for her time and presentation today. Thanks for all our wonderful questions, and we hope you have a lovely afternoon. Take care, everybody.
Thank you. Bye-bye.